What are mental illnesses and how to spot the signs? Welcome back to Health Topic, your channel for health, wellness, and prosperity-related content. Mental illnesses are similar to physical ones in the way that they disrupt a person's lifestyle by affecting our psychological and neurological processes negatively. You should also know that, same as with physical diseases, major mental illnesses rarely appear out of nowhere. People begin recognizing small changes or feelings about their thinking, or suspect others who may have a mental illness from its initial stages. It's important to learn about the developing symptoms of mental illnesses and the warning signs to take action and help. An early intervention can help reduce the severity of the illness and delay it. We'll be listing some important red flags that might arise from a mental illness, with the following 10 signs you need to look out for. As a bonus at the end, we will provide a tip on how to prevent the development or growth of these illnesses. Number 1. Sleep changes. Sleep or appetite disorders can include dramatic sleep and appetite changes or a decline in personal care. Most mental illnesses manifest in several different ways that many people don't realize instantly, though one of the most common ways they tend to show up is in sleep or appetite changes. People will start seeing abrupt changes to their sleep cycle, and a huge decline in their personal care. The cumulative effects of sleep loss and sleep disorders have been associated with a wide range of deleterious health consequences, including an increased risk of hypertension, diabetes, obesity, depression, heart attack, and strokes. Waking early on workdays and sleeping in on days off may not be as restful as you think. A new study suggests that when routine sleep habits are disrupted, your risk for diabetes and heart disease rises. Number 2. Mood swings. On top of that, a mentally ill person might be experiencing rapid or dramatic shifts in emotions or depressed feelings. Illnesses such as borderline personality disorder manifest mostly in abrupt mood swings. Everyone experiences emotional ups and downs, but people with BPD tend to experience mood swings that are more intense and frequent than the typical person and last between a few hours and a few days. Most people that feel borderline personality disorder feel so overwhelmed by these intense emotional outbursts and shifts that they engage in impulsive behaviors, including substance abuse, binge eating, and self-harm. Number 3. Self-harm. Yes, all of these actions are big red flags regarding mental illnesses. A mentally ill person might begin cutting or self-harming constantly, and if you notice any signs that they are, indeed, self-harming, you have to contact help immediately. The National Suicide Prevention Lifeline is always on call at 1-800-273-8255 and can be contacted to deal with these situations swiftly and effortlessly. It is important not to underestimate this. You, or someone you know, may not appreciate the help out there. Take for example the popular song with the same name by Logic and other featured artists, which answer to the question, with a big yes. You are valuable, and you are important. Number 4. Withdrawal. Next up, people with some mental illnesses might experience withdrawal symptoms. They might have a sudden loss of interest in activities they used to enjoy a lot. This one actually has a name. Anhedonia is one of the main symptoms of Major Depressive Disorder, MDD. It is the loss of interest in previously rewarding or enjoyable activities. People suffering from clinical depression lose interest in hobbies, friends, work, and even food and sex. Number 5. Productivity drops. Someone may also have a drop in functioning at school, work, or social activities. They tend to quit sports, fail at school, and have big difficulties performing familiar tasks that they used to seamlessly be able to complete. A sudden productivity drop at work or at their personal business is a massive red flag. Are they going through a burnout spell? Or is it something else? Make sure to be observant of these to find out. Number 6. Oversensitivity. People with mental illnesses have an increased sensitivity to senses like sights, sounds, smells, or touch. It seems like every slightly loud sound sends them off the rocker, and vivid sights and smells might also throw them off. They will avoid every overstimulating situation, and also the use of drugs and alcohol. While excessive use of controlled substances is never recommended, if a person used to enjoy these quite a lot, and suddenly withdraws, that's another red flag. Number 7. Apathy. Another important sign of these is apathy. Apathy is a lack of interest in life activities and interactions with others. If you have a friend that's generally bubbly, or has a friendly disposition, and out of nowhere they seem completely disinterested in everything they used to do, then you should probably check in with your friend to see what's going on with them. Everybody experiences certain amounts of apathy from time to time. You may sometimes feel unmotivated or uninterested in daily tasks. This type is known as situational apathy, and it's completely normal. However, apathy is also a big symptom of neurological and psychiatric disorders, and can also be a syndrome. If a person has a chronic condition, such as a chronic mental illness that's untreated, then they might consider checking in with their psychologist or therapist to make sure it's not a sign of Alzheimer's, a persistent depressive disorder, or even Parkinson's disease. On top of that, an apathetic person will have big problems regarding their concentration, their memory, and logical thought and speech pattern. This can manifest in many different types of symptoms, namely alogia, also known as poverty of speech, with which people give brief and unelaborated responses to questions, or even might experience symptoms of thought blocking. People with thought blocking often interrupt themselves abruptly mid-sentence. They might pause for several seconds or minutes. When they start talking again, they often change the topic of conversation. Number 8. Difficult thought process. Another symptom of problems with their thought process is circumstantiality, also known as circumstantial thinking or circumstantial speech. People with this disorder include excessively irrelevant details in their speaking or writing. Their original train of thought is maintained as normal, but they provide lots of unnecessary details before even circling back to their main point. Number 9. Nervousness. A person with mental illness might be feeling fearful, suspicious, or even paranoid at things that seemingly make no sense. They might be constantly anxious or worried that something might happen to them, even if the chance of this happening is minimal. A big example of these can be found in anxiety disorders. The distress they cause can keep you from carrying on with your life normally. For people who have nervousness, worry and fear are constants and are overwhelming, and can be disabling to a quality lifestyle. Number 10. Unusual behavior. Of course, unusual behavior depends entirely on who's observing the behavior. Knowing that some cultural and societal norms have different ways of manifesting in people's lives. People suffering from psychosis may have an altered perception of reality that often affects their behavior, leading them to act in ways that may be perceived as strange. Problems controlling one's behavior can also occur as a result of brain damage or disorders. An example are people suffering from dementia, and may display strange behaviors. Disclaimer. Please take into account that if you see a person only showing one or two of these symptoms, that's not a powerful indicator of a mental illness. They could be suffering from one secretly, as they could simply be going through, let's say, apathetic moment in their life, or simply be distracted at the moment you're speaking with them. They become a problem if they are causing severe difficulties in their professional, social, and academic life. Bonus tip: how to reduce the risk for a mental illness. Here are some prevention or risk reduction attempts to reduce the recurrence or prevalence of a mental health disorder, and what comes with them. Healthy lifestyles that also include among them a standard morning routine, a good diet, and plenty of exercise help ward off most mental diseases. People need to establish real, meaningful social connections with their peers and family to also feel better. They must have constant support during the stressful transition points in their life, while they are at higher risk. However, it's also important to take into account that some illnesses also have biological, hereditary, or genetic factors that cause their appearance on people. While taking the necessary measures to relax and undergo a healthy lifestyle to avoid them affecting you, sometimes it's harder than simply exercising and eating well. The surefire way of preventing a mental illness from affecting you, or your loved ones, is consulting with a mental health professional who can correctly assess the dangers it might pose to life through helpful action. Now that we've reached the end of our video, take a moment and try to take all of these signs in. Think about your friends, family, and co-workers. Do you know someone among them who have been showing any of these symptoms? Maybe they've suddenly withdrawn from social activities, maybe they just vanished out of work, or haven't been calling you on Saturday night to go out as they used to. It's extremely important to note these symptoms from beforehand to properly assess any possible complication they may have. And don't worry if that's the case. Mental illnesses can be treated, and even delayed if properly diagnosed with time. So, what did you think of these signs? Let us know in the comments section below. Also, don't forget to leave us a like, Share this video with your friends and subscribe to Health Topic to receive more fantastic mental and physical health tips like these. We post videos throughout the week. Health is wealth. Stay safe, stay healthy, stay tuned.